Hey everyone, how's everybody doing today? I hope everybody's doing okay. I do apologize if the video is a little bit shaky. I am holding, my hands are pretty tied up with holding the camera and pointing out certain viewpoints. So, I hope you guys are doing well. I do apologize we haven't done a review in a while. Just been really busy. Hope you guys are doing your part by mediating the decrease of infection by staying quarantined and staying at home, because it is a pretty vicious virus. It can actually lunge itself to the lungs and go straight to the alveoli and kind of do some damage in the alveoli cells, and also goes to the surfactant cells. And as you all know, surfactant is very important because it helps with the lubrication, right? And the wall lining helps with the increase and decrease of surface area, which, you know, allows you to breathe without pain, no shortness of breath. So it really can affect, you know, if you are immunocompromised and a little bit older, it can really affect your respiratory system, and it's pretty vicious. Okay, so be careful out there. So today we will be doing a review for cardiac catheterization and angina pectoris. Okay, now let's go straight to cardiac catheterization. So you all know cardiac catheterization is a diagnostic procedure performed by the physician used to determine specific areas of disease in the heart. And basically what we do is we thread a catheter through an artery, right, and onto the heart. And the physician can is able to visualize the coronary arteries, the valves, the great vessels of the heart, right? Now, this is a pretty important NCLEX question because, you know, you as the nurse do have a large role in playing in helping preventing the complications from this procedure. Okay, so let's look at the nursing considerations that we need to be mindful about for the client undergoing cardiac catheterization. Okay, now basically the client must be NPO at least 8 hours prior to the procedure. Okay, also we need to teach the client the possible entry sites for the catheter, all right, which is usually the femoral and the brachial artery. Okay, and also we do need to assess the client for numbness sensation, right? Also we need to check the pulse and check for any bleeding, right, in the affected extremity every 15 minutes, 1 to 2 hours post procedure. Okay, now a big priority for you is that you need to report to the physician immediately any complaints of chest pain or numbness or tingling and of the extremity. Okay, that is very important. Now let's continue on and talk about angina pectoris, right? Angina pectoris is a pain due to myocardial ischemia, right? There's basically an increase in O2 demand, right? And there's the inability of the coronary arteries to deliver enough circulation in the respiratory system. Okay, now what we're going to look at types of angina, right? There's a few types. There's the chronic stable angina, which is usually just triggered by a overexertion, right? There's unstable angina. With unstable angina, we don't really know when the onset is. It, you know, it's very unpredictable. Now with variant angina, it's also called Prince-Metal angina. Now this one is episodic. Okay, now let's look at the risk factors. Now, risk factors can include hypertension, hyperlipidemia, atherosclerosis, right? Especially with a patient with a coronary artery disease or CAD, right? And with atherosclerosis, there's basically a fatty plaque accumulation, right? And also arteriosclerosis, which are calcium deposits. Okay. Now, let's look at the side effects. Side effects can include headache, hypotension, dizziness, and pain with angina is what we call substernal chest discomfort. Okay. Now, diagnostics would include EKG and angiography. Okay. Now, this is a very, very important thing that we do need to take note in regards to medications, right? We're going to be giving a vasodilator, and the main vasodilator medication that we do need to give is nitrates, right? And as we all know, nitrates basically helps vasodilate the vessels to decrease myocardial oxygen demand, right? And take note that you're giving this 1 tablet every 5 minutes, usually between 5 to 15 minutes, and limit to 3 tablets. Okay. Now, what are the routes of this drug? It can be given orally, can be given through paste, sublingually. It can be a patch, and it could be an IV. Now, for IVs, understand that we do need to titrate this medication slowly, okay? And understand that nitrates can decrease the preload and the afterload, so you do have to be mindful of that. Side effects for this drug includes headache, hypotension, dizziness, and flushing of the skin. All right, and understand that if the nitrate does not relieve angina, obviously we got to give oxygen and morphine. Right. Now, take note with morphine that it can cause respiratory depression. So you do need to be mindful of that. It can also cause hypotension. All right. So you do need to be careful with that. Now, with nitrates, understand that we do need to store the pills away from light, right? Because it can decrease the efficiency, and usually when you are giving it topically, such as an ointment, you do have to use gloves. So this is it for today, guys. We just reviewed cardiac catheterization and angina pectoris, and I will see you guys in the next review. Hope you guys are staying safe. Take care, and God bless. Thank you.